Okay, if you have glaucoma and you're frustrated about having to use your eye drops every day, you will want to hear what our next guest has to say. Dr. Jeffrey Whitman with Key-Whitman Eye Center is here to explain options designed to reduce eye pressure in glaucoma patients. Good morning, Dr. Whitman. How are you?
I am doing good, and it's great to be here today.
I'm so glad that you are here. Let's give a little review. What is glaucoma and how might it impact patients?
Well, glaucoma is a disease characterized by a slow, painless increase in eye pressure, not related to blood pressure, increase in eye pressure that slowly damages the optic nerve at the back of the eye. And remember, I said it's painless, so you don't feel that it's going on. The real take-home serious message here is that glaucoma left untreated leads to permanent loss of vision.
All right, well, let's talk about some treatment options for glaucoma. What are those options?
Well, traditionally, we've relied on expensive prescription eye drops that often had to be used several times a day. But we have some really good stuff now in that we have microscopic implants we call stents that we can place in the eye that not only can decrease pressure, but sometimes can actually get you off your drops altogether.
Interesting. Okay, when you ever think about something in your eye, it kind of gives me the heebie-jeebies. So tell me about the stents. How do they work and how do they help?
Well, we have two basic types of stents. We have the eye stent inject. We have, and we've seen some pictures here now, so they're really microscopically small. We have the hydra stent.
Is that on the penny?
Yeah,
on the quarter?
and this one's on the quarter.
Okay.
And now we also have the iStent Infinite, and we'll tell you a little more about that in a moment. But these implants or stents, the first two, we generally implant, they're a painless implant at the time of cataract surgery. So they're only approved to put in while you're having cataract surgery done. And that was a problem for a lot of patients that had glaucoma that maybe had already had cataract surgery or didn't need cataract surgery. And we get to announce now the new iStent Infinite. In the iStent Infinite, we can implant this stent, again, painless, microscopic. We can do it before you've ever needed cataract surgery, and we can do it afterwards. Somebody's had cataract surgery, they have glaucoma, and they want to reduce or get off their drops. We can use that as well. It works as well as all the other stents in getting that eye pressure down and helping to preserve your vision.
That's fascinating. And seeing that correlation with the coin, how little they are. So the other concern, though, is that prescriptions can be super expensive. So when people are watching this, what do they need to know to determine if they are candidates for this type of procedure?
No, very good point, and you're exactly right. The eye drop prescriptions are expensive. You often have to use them several times a day, and that's why patients want to get off of them. So if you think you have glaucoma, you know you have glaucoma, you need to call us or get online and come into any of the Key-Whitman offices for an evaluation, and we can see, again, what the extent of the glaucoma is and see if you're a good candidate for one of these stents.
That's great information, because there's no reason to live with this. There are different options. So why is it so...
Well, you can't live with it, and you can lose your vision with it.
That's the bigger point. That's
right.
the bigger point. And I would imagine that's part of the reason why having your annual eye exam is so important.
You know, it is so important because if we can pick up eye diseases early, we can prevent permanent loss of vision. We look for things like glaucoma, which has no feeling to it. You don't know you have it until we discover it.
Wow.
Macular degeneration, diabetic changes in the back of the eye, cataracts. Again, the whole game is pick it up early, come for that yearly eye exam, and we can prevent permanent loss of vision.
That's fantastic. We really do appreciate you coming and talking to us about
great
this.
being here today.
Very important topic. All right, so for more information, you can call 214-220-3937, or you can schedule an appointment by calling them. Also, you can visit keywhitman.com and find out information about their various locations in North Texas. Aaron?